Good afternoon, students and other guests. It's a pleasure today to start off this session, which is going to feature Martha Lang, one of the faculty of the Health in the Public Interest Program. And it's going to be moderated by Callie Haitayan, who is one of our students. And a few words about our program. It's a program that looks at health, public health, healthcare through a lens that focuses on social and other non-clinical, non-medical determinants of health. So we're very interested in the sociological, anthropological aspects, the healthcare disparities that result as a function of those things, et cetera. So before I get started, let me just say a couple words about how the seminar is going to run today. It's going to consist of a short introduction by Callie, followed by roughly 45 minutes from Professor Martha Lang. And she is likely to choose to use the chat occasionally for responsive elements. Otherwise, we'll leave your mics turned off until the question and answer session, which will start with questions from our students and then expand to other guests. So thank you all for being here. And I'm happy to start this out by asking Callie to introduce Martha Lang.
Hi, everyone. Thank you all for coming today. And thank you, Dr. Lang, for taking the time to speak with us. I know all of us HAPI students are happy to see you again. And for everyone who doesn't know you, Dr. Lang is a medical sociologist with a passion for public sociology and community-based praxis. In addition to her academic work, she's a developmental editor and book coach who helps authors translate their life experiences into accessible narratives and use storytelling as a practical tool for social change. Dr. Lang earned her PhD in sociology from Brown University, specializing in medical sociology and social demography. Her career has blended teaching and academic research with community-based projects, such as a statewide assessment of autism services in Rhode Island and evaluating the Healthy Families Indiana program for children living in poverty. Dr. Lang has taught courses on the history of pandemics, health social movements, and public health policies at institutions including Brown University, Smith College, and most recently, Georgetown University's HAPI program. Her teaching and research include a strong focus on the history of the HIV/AIDS pandemic, harm reduction, and the role of intersectional factors such as gender, race, class, nationality, sexual orientation, and gender identity in shaping local, national, and global responses to health crises. In recent years, she has focused on using constrained choice as a model to inform health-based policy, and her latest research is in this area forms the basis for today's presentation, which will be on social media, peer pressure, and health choices in the face of epidemics. And a small fun fact about Dr. Lang, before she went to college, she worked in a fish market. She said that was exhausting and messy work, but it taught her a lot about the ocean, the earth, fish, and people. So with that, Dr. Lang, you can go ahead and get started.
Okay, great. Hello, everybody. It is wonderful to see familiar faces again. Um, and let's see. And of course, the technology is doing its thing. So let's try this again. All right. Constrained by connection, social media, peer pressure, and health choices in the face of epidemics. As my students know, I love talking about epidemic disease, and I've been thinking about epidemics more metaphorically this fall, and that is one of the things that led to this. And the other thing that led to this discussion is some work that I've been doing with a social theorist from the 20th century who has proven to be very influential in um, understanding what's going on with social media and peer pressure today. That theorist is Theodore Adorno. So, I'd like to start with perception and action. This is a lesson I got from a park in London. I just came back from a visit with family in London, which featured a lot of walking through the city and going to parks with my brother and my 2.5-year-old nephew. Um, if you've been around a toddler, you know they are inquisitive and forever commenting and asking questions. Well, we were walking by a particular park one day and he pointed and said, "Look, mice." Well, it wasn't a mouse, it was a brown rat. And my brother had to pause and think about this because another brown rat showed up and another and another. It appeared there was an entire clan of them hanging out in that particular park in the middle of the day. And my brother had to correct him because we don't really want children thinking rats are cuddly little mice to play with. But it struck me that misinformation happens on a regular basis. And how and when it gets corrected is crucial to our understanding of the world around us. Can you think of a time when you had a complete misperception about something that you thought was benign, but in fact turned out to be quite the opposite? If you could just make a note in chat about that, that would be great to hear. I am not seeing any comments, so I'll go to a few more seconds and then we will move on. Um, the interactive stuff is there to keep you engaged and thinking. So I want you to, even if you haven't written anything down, think about perception versus reality, and how that shapes your own view of the world and of your health. All right. Okay, so we're going to start with the constrained choice model, which I introduced to the students in August. This is a model put forth by Bird and Ricker, and I did some work with them on several publications after their initial model, adding elements of intersectionality to the model. So constrained choice is used to understand how individual choices are shaped by a variety of broader pressures at different levels of society. At the broadest level, we have social policy. So, for example, um, let's take the example of cardiovascular disease. If we have a society that a country that does not have any policy related to the foods we eat. For example, do they ban trans fats, right? Uh, are there incentives? Are there lobbyists who shape what foods get marketed to people, such as the sugar lobby, for example? Those policies can shape an individual's choice at the grocery store. At the community level, what is the place where the person lives? Are there safe places for them to walk? Are there safe places for them to exercise? So, not just safety, though. What about the question of stress? How does stress like crime, noise, pollution impact their choices around exercise and health? And also, how does that stress impact their cardiovascular system through allostatic load? Work. Work can be inactive or it can be overactive, depending on the role. And that can impact cardiovascular health. And family. Um, We know that we eat as our family does, for example, and so that can shape individual health choices. We often move and exercise as our family does. And so that again shapes individual choices, and these interact with biological processes, and these in turn affect health outcomes, morbidity, and mortality. Um, so this is one of the ways we understand um, racial disparity in health and gender disparity in health. So one of the things, if we look at policy, we see that we've made a lot of mistakes through the ages, and this comes back to this question of both community level constraints on health and societal level, federal government level constraints on health. If we look at the Great Plague of London, and I will also tell you the other thing that I thought about as I saw my nephew was and looked at that one of those rats, I said, I wonder if you're one of the descendants of the rats that caused the Great Plague of London, because I am a geek. But on that note, um, there was perception and reality with the plague. So one of the perceptions, according to Defoe, who wrote allegedly a journal of the plague year, except that he was 5 years old when the plague actually happened in London in 1665. So we're not sure where the account came from, but this is often cited. The mayor of London declared that cats and dogs were spreading plague. And so he called for the killing of them. According to Defoe, 100,000 cats were killed and 40,000 dogs. And in reality, cats and dogs um, were the only natural predators to um, the black rat. And so this, in fact, made it worse. When we look at real social factors, we know that urbanization played a great deal of a role in the spread of the plague. And with that overcrowding, fleas, human fleas, rat fleas, and lice all spread plague. The other reality we know is that there were class factors involved. Those who were wealthy fled the city, and therefore they had better health outcomes. If we look at cholera in New York City, we see that there were some information provided that was in fact not correct. Uh, I will, so cholera is passed by, anybody want to just unmute themselves and call out what is cholera caused by? Just unmute yourself and call it out.
Bacteria.
Yes, right. From drinking water, right? Well, so this is from the New York's Public Health Department. Be temperate in eating and drinking. Avoid raw vegetables and unripe fruit. That was probably sound advice because this is, in fact, one way that it could be spread. But abstaining from cold water when overheated, that's what heated means, and above all, from ardent spirits. So you're not supposed to drink cold water and you're not supposed to drink alcohol. And sleep and clothe warm. So this was actually not good guidance, right? But this is what was known in 1866 before germ theory had really taken hold as the dominant paradigm in public health. In reality, we know from Rosenberg that the reality is that it was spread by unclean drinking water. It was spread by overcrowding because it could be spread by person to person through oral fecal route as well. And so this is another place where the community government got it wrong. Another brief example, polio. This is from 1916. The perception was that flies spread polio. There was a great deal of spraying for flies in the early 20th century, and it did absolutely nothing to control polio. The reality is that we know polio, in fact, was spreading because fewer and fewer children were exposed to it in infancy, the cleaner we made our society, the more vulnerable we made children to a severe case of polio. And so again, there are places where we don't get things right in public health. All right. So I'm going to just take a moment and tell you when I say epidemics for the examples we're going to be working with, I'm going to be expanding the definition to basically include anything that is a growing and pressing public health problem. Obesity and opioid addiction are two of those. We're going to be focusing down on obesity in particular with this. So in looking at obesity, I want you to think about what the socioeconomic factors are that drive obesity. Going back again to that constrained choice model at the governmental level, how do food lobbies affect obesity? How does advertising affect obesity? And also, if you think about obesity solutions, we have weight loss drugs, but we also have a variety of fads that get echoed even more and more within social media. And I'm providing you references throughout, and there's a bibliography at the end of these slides, so you can go back and look at them. But Guthman has done some very good work on the medicalization of obesity. And this was even before these semaglutides came out. So again, some more sources on opioid addiction. So epidemics, in this case, we're looking at harmful social behaviors in a broader social context, not just at the individual, but at the broader forces that drive them. So Adorno looked at culture as an industry. He was a German sociologist from the 1930s and 40s. He was part of the Frankfurt School. There's his picture. And he was interested in this question of what happens when culture becomes a commodity. So he looked specifically at music. So at the time he was writing, recording of music was a relatively recent innovation as far as mass production of it and availability of it had only happened in the past couple of decades. So he was looking at that and he was looking at radio, and he was concerned that when media is mass produced, it is designed to go down to the lowest common denominator and keep people passive and conformist. He said that it would limit critical thinking by giving people prepackaged entertainment and information. Rather than people creating music, they were now absorbing music. Rather than people creating stories or sharing stories, they were now absorbing stories through movies and radio. All right. So I'm going to pause for a moment because I'm tired of listening to my own voice and ask you to just write down, and we're going to come back to this during the question and answer period, of some ways that one or two ways that you can think of culture as being a mass-produced product right now. All right. Culture as a mass-produced product. Some particular phenomenon. All right. For example, you could do anything on Taylor Swift. All right. So just write down for a moment, and then we will continue on. Okay. So what's interesting about Adorno is I kept asking myself, because I was reacquainting myself with his work over the past few months, what would he say about social media? Well, social media has created an even deeper echo chamber than what he predicted. So when the algorithm encourages us only to click on ideas that support the things that we believe, we create even greater uniformity of thought and behavior. All right, so this is one of the things that is very striking, where Adorno's analysis was prescient and still holds up today. This, by amplifying popular trends and opinions, this can lead to something called groupthink that we're going to talk about in a moment. And peer pressure on platforms like Facebook, Instagram, Twitter can shape health-related decisions like vaccine hesitancy or weight loss fads. So, we see this, so we see that social media can act as a modern extension of the culture industry. And people are often influenced to conform to misleading health trends and popular misinformation. So I'm going to stop sharing for a moment and ask you to think about, and now I'm seeing everybody's notes. So I may be done with my slides. I only have a few more of them. So I would much rather interact with you in this way. Um, John Grogan, can you say something about collective bias?
Hi, everybody. I, my thoughts are that we go to Facebook and the algorithm directs us towards other things that we already believe and reinforce that belief.
Yeah, yeah. So we get an echo chamber effect going. Great. And what are Brian Kaiser, Marvel movies. Could you say something about that? Or
Hi,
not?
Martha.
Hi. Hi, Brian.
Good to see you.
It's good to see you.
Um, I'm standing in line getting a sandwich right now. Sorry if there's background noise.
Okay.
I put down Marvel movies and then thought about it more, and I put in Love is Blind, the reality TV show, which seems to me, having only seen like half of one episode, that
Okay.
it's instilling ideas about what relationships are supposed to be, what we're supposed to look like in our relationships. I don't mean visually, I mean, how we are
Right.
supposed to engage in relationships.
Right.
And set a standard that we're supposed to
Right.
aspire to, that we're supposed to meet.
Yep. Great. Yes, exactly. These are great examples. Let's think about health. All right. What are some of the health beliefs that you have seen on social media that you know are not correct? COVID and masks. Yes, indeed, Hannah. Okay. So, or that masks will actually give you COVID. That was an interesting one as well. So other things people have seen. Yes, Aubrielle, good example. Vaccinations and autism. This is the sort of, there had been some anti-vax movement at some point, but this was sort of the place where the anti-vaxxer movement really gained traction in our society right around the turn of the 21st century. So that's a great example. So COVID was created by the government for population control. Yep. Okay. So these are
Hi,
all,
can I get
yep.
a
Go ahead,
chicken
Brian. Go
club
ahead, Brian.
original wheat with jack cheese?
Oh, Brian's
Provolone.
mic is still on.
Ooh,
There we go. Okay. So sounds like you had a good sandwich though. All right. So these are all really typical examples. When we think about peer pressure, social media, and constrained choice, I want to come back to another theory of Adorno's on the authoritarian personality. You've heard of the authoritarian personality? Show of hands. Okay, this is good sociology to come back to, but according to Adorno, he was curious at the end of World War II. He wanted to understand how Hitler happened and Nazism happened, and he came up with this construct with his colleagues of the authoritarian personality. But one of the things that the authoritarian personality has is a deference to authority. And another thing that we see with the authoritarian personality is the authoritarian personality is more likely to be vulnerable to engaging in groupthink. That if the social group that I am surrounded with thinks something, I think it too, and the ability to think critically starts to disappear as groupthink rises. So we see a rise in the authoritarian personality in the era of social media. And with that, the misinformation feeds the authoritarian personality, and the authoritarian personality feeds the misinformation. All right. So I want you to pause also and think about semaglutides, for example, Ozempic, and all of the things you see on social media regarding the use of these. And also, I want you, because, I started with statements and proclamations that were made by governments, okay, about public health that weren't right. I want you to think also about semaglutides and their impact on as far as what medical science is saying about them as well. You can either raise your hand or you can type something down in the chat. Yeah. So yes, Arthur Allen, good example of Rush Limbaugh's ditto heads that preceded Trumpism. So we see that this was a growing trend. It didn't just show up, right? It's just that it has currently exploded with the rise of social media and with the societal destabilization that happened with the COVID pandemic. Arthur Allen also notes Ozempic is the brand name for a semaglutide. As a group, they aren't called semaglutides, but rather GLP-1 agonists. Thank you, Arthur, for that correction of my language. So, yes, Bob Speth, yes. Okay. Adrian, would you like to talk a little bit about your comment here?
Sure. So the idea that obesity is a disease was created by industry. It's not a disease at all. There are plenty of healthy obese people. There's plenty of unhealthy not obese people, and everything you see about these medications reducing chronic disease is basically wrong. And people aren't talking about the fact that they cause pancreatitis and optic nerve problems, gastroparesis, probable malnutrition, etc.
Right. Yeah, the side effects are quite alarming. I have included in the references two different items. One is um, a look at the use of these particular medications in people who are not obese for weight loss and the complications that appear. That's a JAMA article, and I'm blanking on the author's names. And the second is a statement from the EMA, the European Medical Authority, on psychological side effects that have been observed with this particular class of drug. And Jennifer says, as well as the idea that skinny equals healthy, which can lead to dangerously restrictive diets. Yes. So, how many of you know someone who is on a diet that they learned about on social media or that is trumpeted on social media? Show of hands. Yeah, right. So this is a thing. Um, so what I want to talk with you about now is some of the public health solutions to this issue. All right, because of course I'm not just going to leave you here despairing. So I'm going to go back into my slides for one moment. We'll talk and then we'll discuss. Except that I do have to share it with you. Hold on one second. Okay. So there are a couple of different ways to regulate social media misinformation. One thing that some countries have done with considerable success is to demand transparency on the algorithms that are used in social media. So if at a national level that is regulated and social media has accountability, that's one very direct thing that countries can do. And so we know that this can help slow the spread of misinformation and also slow the echo chamber effect. And in addition, as you've likely seen on at least YouTube and a couple of others, there is sort of a disclaimer and accurate information that is added under any controversial topic. Community actions, we can build community campaigns that counter social media with accurate health information. And that said, there really needs to be something done with social media to stop the echo chamber effect at the same time. At the work level, create work policies that support informed choices and health autonomy. So we'll come back to what that means. Encourage family-centered education to resist social media influence. We're going to come back to that as well. And then promote critical media literacy and empower with accurate public education. So you've got those in mind. Okay. So what can workplaces do specifically to help educate their workforce on accurate health information? I want you to think about that for a moment. So Bob, can you say more about that?
Yeah, sorry, I was on mute.
You're fine.
Okay, well, I had an experience over the a weekend ago. I was on a walk for Creutzfeldt-Jakob disease, and I was talking with someone who was ex-Navy, submarine, and I have an interest in the global warming crisis. And, since he was on a Navy submarine, it was nuclear powered. And I wanted to chat with him about the likelihood of putting small nuclear installations in that would be safe and would not be so costly. And, he was very interested and, talked knowledgeably. And then I said, this global warming crisis with the accumulation of carbon dioxide in the air is, very worrisome. And nuclear power would be one way to stop adding carbon dioxide to the environment. And he says, well, I've done my own research, and carbon dioxide is not what is causing global warming. It's water vapor. And he said, and I don't want to talk any further about it. So where do you go from there? I mean, what I did was I said, well, okay, then let's try and find something to talk about that we agree upon, because I'm sure there's more we agree upon than we disagree upon. But the fact is that this guy did not want to be challenged on his idea that there's no increase in carbon dioxide and that water vapor is causing global warming. How do you deal with that?
That is an excellent question. Again, it comes back down to the root causes of it. I have ideas. I would love to hear from other people. I would especially love to hear from some of our students because I know that we did a lot of brainstorming sort of on health policy in those final days of my week. So I would love to hear from one of my students, and I'm like giving all of you the eagle eye right now. So okay, CJ, you go ahead.
Perhaps
Go ahead.
asking more questions about what the other person believes and to try to get them to follow out their thoughts
Mhm.
and see if there's room for anything there.
Yeah. So that's one, further engagement is one way. All right. But yeah, you've got somebody very fixed in their ideas. CJ, you looked like you were going to say something. You weren't going to say something. Okay. I take it back. All right. But yeah, that's one good idea, Francis. Um, other folks. What we do know is that um, when we come up with solutions that start to break up the echo chamber, that's where you start to see some real change. The other place that I think shows promise is we're getting better and better data on the effect of screen use in children. And so one of the things I've been thinking about is perhaps that just screen use and screen time are one way in for us to affect change here. And children are a group that that is not controversial. No one wants kids hurt, right? So maybe that's our entry point. For example, the analogy I think of is with when smoking was banned in public places, it was based on the fact that the workers had no choice but to inhale all of that secondhand smoke. So no one's going to argue that waitresses deserve to get sick from inhaling secondhand smoke. No one is going to argue that children's brains should be damaged from what they absorb in social media, that adolescents' self-esteem should be damaged from what they absorb in social media. So this strikes me as one way in. So thinking about the non-controversial points of entry is what I would say is one place. And again, that comes back to policy. So, what are other folks' ideas on this or thoughts on this? So at the community level, I'm going to move back down through these, finding ways to counter local misinformation with real information. I do not know how much this spread into the national media, but there were rumors going around North Carolina earlier this week that there were militias attacking FEMA. Anybody see this coverage? Show of hands. Okay, yeah. So it turns out it was one lone individual with firearms, right? And that information was released, and FEMA workers are now once again doing their job. So that's an example of a direct community intervention. These are small, but they do add up. And at the work and family levels, again, we're looking at small interventions. Okay. So taken together, these are the places where we can start to affect change. And these are the places where we learn not just for ourselves how to recognize when a mouse is a rat, but also how to guide society in recognizing when a mouse is a rat. I thank you for listening, and I look forward to your questions.
Okay, so with that, we're going to turn it over to Callie, who's going to first take questions and comments from students, followed by the broader audience. So Callie.
Yep. Okay, so do any happy students? All right, Abrielle, go ahead.
I'm just curious about your opinion, Dr. Lang, on some states who are doing phone bans in schools. So I know that Virginia, I think, is either in the process of putting that through or some districts already have. What impact do you think that that will have on children's social media use and the implications of that? But then also, what challenges do you think arise with banning phones in schools?
I haven't thought this through a great deal. I've seen about it in passing. The less time children have on screens, the better. I will tell you, as a person who has taught college students, pre-cell phone and post-cell phone, students were definitely more engaged prior to the advent of screens. Those are young adults, though. Those are not children. The world got along fine without having a cell phone attached, without us having cell phones attached to our hips for vast millennia versus a blip of a blip of a blip when we have had cell phones. So overall, I would say it's likely a good development. I will turn it back to you, Abrielle, and ask what you think about it.
I think it's beneficial for the conversation about paying attention in school. I think less so in terms of social media and cyberbullying, because when they go home, they'll just go home and participate in that. I think a concern that I've thought about was the violence in schools and being able to contact a parent if anything should happen. So I think that's a tension. So yeah.
Yeah. Yeah. Yeah, thanks. It's a simple, that would be an example of a, basically, if we're going to think of education as students' work, that would be an example of a workplace policy in opening up choice for people. So good question. Thank you. Okay. Mickey.
Thank you, Dr. Lang. A few moments ago, you mentioned that we had to use non-controversial ways of entry for policy implementation. And I was wondering, we've been recently talking about special interests in policy and versus the community's actual populations. And I was wondering, who do you think weighs more into the non-controversial way of, I'm trying to figure out how to word it. Does it have to be more non-controversial to the special interests or to the communities to make more of a change?
To the communities, because in order to get people behind a sweeping public health change, you have to get widespread on the ground consensus that it's a good thing. You will recall the polio vaccine campaigns that we talked about. It was not controversial to get your children vaccinated when everybody knew of someone who had died or been crippled by polio, right? And children, sick little babies, are an incredibly powerful catalyst for change. I remember looking at the cost of NICUs in the United States and commenting on just the sheer amount of money that was being spent versus outcomes, which was a very different story, I will say in my defense, in the early 1990s than it is now. And my professor said, "You don't understand, Martha. Sick little babies are a huge motivator for people." So we find that non-controversial population, like anybody who knows a waitress, for example, if we go back to secondhand smoke, knows how hard the work is and knows that they are exposed to all kinds of stuff. So a waitress, a wait person in general, it's not a controversial population that, yeah, we want to protect these people. So, so yeah, community consensus, I believe, is most important. So,
Michaela?
you're muted.
Hi, Dr. Lang. Thank you so much for joining us today. I had a question kind of going off how we talked about cholera and the Great Plague of London being examples of how culture could lead to like the spread of misinformation on diseases. Are there examples of how it could lead to the spread of information to benefit certain health issues, or do you have an example of like times when it was really effective?
Yes. For example, I have to go back and look the exact date, but I believe it was 1986 or 87. The federal government sent out a pamphlet explaining AIDS to every single household in the United States. It's long before social media, so a government mailing was the best way we had to give information. And it explained how it could be contracted and how it could not be contracted. That didn't make HIV stigma disappear, all right, but it made it less and it lowered people's panic level a couple of degrees. So that's one place where it worked. The polio campaigns, again, were a place where correct government information about polio has worked well internationally. Different polio campaigns to eradicate polio. The most successful campaign we had that used correct government information is smallpox. Okay, smallpox is now eradicated from the world through public health action and public health campaigns, because you can't just go shooting people in the arm with polio, with a smallpox vaccine without getting community consensus behind it. So we do have some good examples of that. Not as many in recent times. However, I remain an optimist or I would not be a teacher, so it could happen at any time. So thanks.
Okay, Hannah?
Hi, Dr. Lang. Good to see you again. So, how do we prevent conformity? Are there specific traits or characteristics that an individual may possess that would make them less prone to it?
Yes. Critical thinking skills are important. And we know that time spent reading is actually a good predictor of lower conformity as well. But we have to be careful of what that reading is. That doesn't mean thumbing through social media. It means reading books, magazines, newspapers, etc. Time spent with people unlike oneself is also a good way to lower conformity. And when you speak of conformity, let me make sure I understand that you're talking about the authoritarian personality in particular. Yeah, yeah. So yeah, those are good ways to address this. The other thing is that we see a rise in authoritarianism when we see shifts in social stability. And so one of the things to remember with the situation we have in the United States, we have similar happenings going on in Europe as well. We are at a crossroads as far as a shift in demographics, a shift in power structures, and with that, you inevitably see a rise of authoritarianism. So that doesn't necessarily make it easier to get through, but it's helpful to know that this was predictable according to Adorno and colleagues' construct of the authoritarian personality. So.
Okay, if there aren't any more happy students with questions, we can open it up to the rest of the viewers. Looks like there's a question in the chat from John Grogan. Is the smartphone a vector for social ADHD? Likewise, 12 minutes of commercial advertising on TV every hour for a lifetime may have measurable negative effects on our human capacity.
So John, can you say more about that?
Thank you, Dr. Lang. No.
Okay.
I was hoping that maybe some of the students could react to it as well.
Oh yeah, I would. So I have my ideas, and I'm going to guess, and looking at you, you and I may be of similar generational background. So I'm going to turn that back to the students and ask them to raise hands and answer because I'm very curious before I give my input. So.
Can I just supplement that I have a cell phone with no SIM card, and I do that intentionally because I want to be offline as much as possible.
Yeah. Going to come back to Arlene's question as well. So for my students, tell me, what do you think social media might be doing as far? Do you think it can cause ADHD?
I will say I've been off of all social media for a few months, and it's made a noticeable difference in how fast I can complete a task and just my general well-being. I'm liking not having it. It's been better for me, more so even than I thought it would be.
So can you say a tiny bit more about that?
Yeah, I just think that there's not much to do on my phone anymore. So I'll check my email and I'll read the news, respond to text messages. But then there's not like, I'm not being flooded with images and ideas all the time. I think it's, we read more in 20 minutes than a person did in their whole lifetime 100 years ago or something. So I can just focus on what actually matters.
Good. Thank you. That's so Francis's scientific sample of 1 demonstrates an improved attention span. So, all right. Other people, have you experimented with this, thought about it?
In undergrad, I took a class called like neurodevelopmental something in technology, and I did a project on multimedia or media multitasking in youth and the effects that that has. And so they're finding that the more youth media tasks, so meaning like they have like a TV show on, but like they're scrolling on Instagram or they're listening to music while like, yeah, looking on Twitter, and switching between applications and attention, that they're finding a lot of mood impact. So like they're more likely to be anxious and depressed. And surprisingly, they didn't actually talk, at least my scope of research didn't look a lot into like diagnosing ADHD or attention span, but they did have difficulty in trials where they had to disregard irrelevant information, they had a lot of difficulty with doing that. And yeah, we're more likely to be depressed and anxious.
Okay. Yeah. So we also have research done. So see what we're learning from. So you all have grown up in an era where it's almost been ubiquitous. So this really impacts you in a direct way. Anybody else have something they'd like to add on this? Okay.
Derek,
Go ahead.
were you gonna continue to respond or?
I was, do you have, I was gonna respond to some of the other things that have come up in the chat, but did you have a point you wanted to raise, or were you
I was gonna bring
moderating?
up something in the chat as well, so you go ahead and.
Okay, you go ahead and bring up something in the chat. That's fine. I will let you do your job. I apologize, Callie. So
That's okay. I just wanted to point out Arlene's question in the chat. And she said, Maria Resna has said that a lie travels 6 times faster on social media than a truth. Given that, how do we counter the lies?
So I'm going to add to the chat a reference that addresses some of this from Vusugi. I hope I'm pronouncing the name correctly, and colleagues. It isn't true that lies or fake news do spread more quickly, but Vusogi offers several different ways that this can be addressed through a couple of different interventions, as does work by Lewandowski. So hold on one second. So I would suggest looking at those. We are getting better information on how you can inoculate people as far as, so coming back to that question about conformity, as far as getting people to think critically and skeptically of what they absorb and where the source is from, proves to be a good way to inoculate against false information when it comes through. So, and that was what I was going to respond to, Callie. So what else do we have?
I'm not seeing any other questions in the chat. Is there anyone who would like to ask another question?
So I would like to throw something out there. So, we hear a lot about, the effects and the misuse of social media and information technology, modern information technology in general. And I think that's all very important. But on another level, how much is going on in terms of trying to understand what is it that drives people to engage in it the ways that they do and the extent that they do? What is it what's the reward system, or what are people seeking, or I suppose there's a lot of answers to that, but I'm just curious what you have to say about it.
I have thought about this some. There is the biggest issue neurochemically is the dopamine hit that comes from receiving feedback and also from seeing one's opinion echoed back or even parroted back by another person. It's fascinating to me that one of the pieces of misinformation that is now floating around on the internet is that people need to engage in dopamine fasts. How many of you have heard about dopamine fasts? Yeah, okay. And so uh anybody want to tell us about what a dopamine fast allegedly is? Just unmute yourself and start talking. Bob, are you going to talk about dopamine fasts?
I imagine it's something
I've come across it, and just trying to not be so oh, what's the word I'm looking for? Pleasure seeking.
Right.
Trying to refrain from obsessively seeking pleasure.
Right. So what's curious is dopamine is absolutely essential to our neurological function. You cannot fast from it. So what we are calling a dopamine fast has actually nothing to do with dopamine. It has to do with taking oneself away from the stimulus of social media, which can create dopamine reinforcement, but any addiction can create dopamine reinforcement. So the other question is, if someone is fasting from social media, what are they doing to substitute it? Because I do believe we do get hooked on our iPhones and smartphones. So, um, so I think a lot about that reinforcement loop as far as what that is doing to the body. We still don't know what the full social consequences are of the pandemic. We're now at a point where we're allowed to start talking about it again, but we don't know what that period of disconnection and separation did to us. But in looking at the research on this as I prepared this talk, there is a distinct difference between what was being reported in the literature in 2019 versus, say, 2022, 2023. It looks different to me. It's not enough of a sample for me to say something shifted, but I think in real measurable terms, something shifted with the way we engage social media that happened to coincide with the pandemic. So we still don't know fully the consequences of that, and we don't know what the health meaning is of that. And some of what we see with health behaviors in social media is infinitely predictable. How many different medical innovations have we seen that we're told are going to completely transform society and turn out to have unfathomable, unanticipated, and negative consequences? You remember when they were talking about putting Prozac in the drinking water? Anybody from my generation? I know there's a couple of you in this group.
Like the Pied Piper of Prozac?
Right. And it turns out Prozac causes some wonderful effects and also can cause a world of hurt. And we are now engaged in a giant, unregulated. I want to hear about it actually happened accidentally, Adam, in a moment. I'm just going to finish this thought. We are now with the Ozempic, Wegovy, and the generic or compounded knockoffs of them engaging in a giant, unregulated, unsystematic field study of getting this into millions and millions of bodies. And we have no idea what the consequences are going to be. So, Adam.
I would just commenting on the fact that, a lot of these chemicals, especially psychiatric drugs, are actually in our drinking water now.
Yeah. Yeah. From people flushing them down the toilet?
Yeah, that's one route, yeah.
Yeah. Yeah. So they are. Okay.
Okay, well, I guess I'm going to throw in my hat as a pharmacologist and defend semaglutide and tirzepatide, which is also known as Mounjaro. They are cardioprotective. People who were on semaglutide were less likely to die from COVID. Let's see, what other some there may be some slight
don't make me get into a fight
benefits.
with you, Bob. We only have short-term data on these drugs, and there's a dropout rate of about 75% in the clinical trials. So Martha's right that, it's going to take a few years until we find out some of the negative effects of these drugs.
Okay, we can agree to disagree on this one, which is one of my favorite hobbies.
Okay. I would love to agree to disagree with you on this, Bob. So I am not debating that they can have a profound effect on the body, and they appear to have all kinds of um, protective factors that we could not have anticipated. And we don't have enough data to know what the negatives will be. There will always be negatives, but we know that there's gastroparesis. We know that there's pancreatitis, right? Like there's no way around that. And when you get it into a larger population with less medical oversight, what's going to happen? I don't know about the European data on the psychological impacts of it, but I'm curious. It's now being suggested that these be used to treat addiction. That's going to be a curiosity as well, given that addiction often has roots in trauma and complex other factors that cause it. Those don't go away by giving somebody semaglutides. So
Okay, that was one thing that did concern me, the possibility that it could be causing anhedonia because it can help you give
right,
up cigarette
right,
smoking,
yeah,
food addiction,
right,
drug addiction. So is it possible that it's just taking away anything that gives you pleasure?
correct.
And the data so far suggests that people who are on these GLP-1 agonists actually have a better outlook on life. So the anhedonia argument is not correct. There's not an increase in suicidality. So, I'm sorry. I'm sold on these drugs. I know there are some adverse side effects. One thing that you didn't mention is the possibility of some optic nerve damage.
Yeah.
But I also forgot to add that it also helps with sleep apnea.
Okay.
So I have a comment, which is not to prolong this argument, but I think related to it and also related to your talk itself, Martha, and that is that, it's really hard for the public to deal with the ebbs and flows of science when it comes down to fairly specific phenomenon, drugs, diseases, etc. You saw what happened with Fauci and the whole thing about gloves and aerosols and all of that, and how badly Tony suffered from the all the grief that's caused him later on from basically the non-vaccine believers. But you could look at anything from aspirin to contraceptive hormones, etc. And you see these ebbs and flows where taking half an aspirin a day or a small dose of aspirin every day is pretty much good for anybody who is at risk for heart disease, to now when they're not recommended unless there's a specific history or indication for it. Contraceptive hormones for cardiovascular health has gone from the belief that it's causing thrombotic strokes and myocardial infarctions, et cetera, in the early days, to a period when it was going to save everybody from these diseases, to back to the original idea, and now coming up again as well. It can help some people, and we ought to give it another look and start using these again for that purpose. And then another related phenomenon is that when drugs come out on the market and start getting used relatively widely, like these semaglutides are today, there tend to be all these reports of other things. And I'm not saying that they're wrong, but they haven't been fully vetted. I mean, if we didn't know after 30 years of experience that a small dose of aspirin was going to cause brain bleeds, how do we know what Ozempic is really doing? And I'm reminded again of what we have been through with the statins, that very early on. I don't know if anybody, I mean, there's not a lot of people on this call that were, alive or finished with college, but at this point in time. But if you look at the early reports of what statins were doing, they were almost a panacea.
Yeah.
There were reports that it was preventing cancer and all kinds of other things. And, all those things that have gone by the wayside, and we're arguing about whether the basic idea that that statins are preventive of heart disease is even up in the air. So, related to your talk, these kinds of things kind of illustrate how even educated, thoughtful people, I'm not saying I'm educated or thoughtful, but struggle with how to interpret information.
Yeah. And in my own health, I have thrown my hands up in the air many times when a report comes out that contradicts what the scientific wisdom was previously across decades. If we look at hormone replacement therapy, for example, yeah. So
Yeah, I argue with my primary care physician who she says, like, look, you won't stop taking your aspirin. I'm not going to condone you stopping your statins. So I don't know. We all have to make our own choices, I guess.
right. Which comes back to the being educated and learning flexibility versus conformity. So
I hate to be the last one to be just mouthing off. So, Callie, do you want to check for further questions for the last couple minutes here?
Can I just append that? I mean, Ozempic started out as an anti-diabetic drug, and we know how bad uncontrolled diabetes is. So why don't we just face the fact that the immediate benefits of Ozempic for controlling blood sugar are so overwhelming that the risks associated with the use of Ozempic pale in comparison to the benefits to the huge number of people in the world that have type 2 diabetes.
So, Bob, it's not a first-line diabetes drug. It doesn't actually work that well for diabetes, which is why the people who are using it for weight loss aren't like bottoming out with their blood sugar. So it's also used in much higher doses for weight loss. So we should fight about this offline.
Okay. I'm going to be up there in November.
Okay, it's a date.
Okay, we might have time for just one more quick question. It looks like John Grogan in the chat said, have the TV advertisers become the 21st century authoritarian personalities?
So, I guess it's where is Marshall McLuhan when we really need him, right? Like thinking about all of these things that have to do with the media and how they're used. And I don't think, John, you can nod your head. I don't think you were really looking for a definitive answer to this, but I appreciate your full participation today.
Thank you, sir.
Yeah.
Thank you. Thank you.
I think we ought to call it a day. It's now almost 1:15, which is our hard stop. I just want to thank Martha for spurring a lot of great conversation and one of the best discussions that we've had this year after seminars, and Callie for her great introduction and background work and moderating today. And thank you all. And I'll turn it back to Callie for the last word.
Well, thank you, Dr. Lang, for taking your time to speak with us. And thank you, everyone, for coming. I hope you all have a great day.